Hey everyone and welcome. Today we're digging into a supplement you've almost definitely seen on the shelves, Coenzyme Q10, or just CoQ10. It seems to be everywhere, right? But what does it actually do according to the science? All right, let's get into it.
So you hear it linked to a whole bunch of things, improving your heart, helping with energy, maybe even tackling headaches. But how much of that is real and how much is just hype? Well, that's exactly what we're here to figure out.
But before we can even touch the potential benefits, we gotta get on the same page. What in the world is Coenzyme Q10?
Okay, so at its core, CoQ10 is something your body already makes. Its number one job? Helping your cells produce energy. You can almost think of it like a tiny spark plug inside the little power plants in your cells. Plus, it pulls double duty as an antioxidant, which helps protect those cells from damage.
All right, now that we know what we're dealing with, let's get to the main event. We're gonna walk through 5 specific areas where scientific studies suggest CoQ10 supplements just might, make a real difference.
First up, the big one, heart health. This is probably the number one reason people grab a bottle of CoQ10. And you know what? There's some pretty interesting research to back it up.
A lot of the research zeroes in on inflammation. For example, one study with people who already had heart disease found that CoQ10 actually lowered an important inflammatory marker called C-reactive protein. And that's a big deal because doctors often use that marker to gauge heart disease risk. Some other research even suggests it could help shield the heart from damage caused by certain kinds of chemo.
Moving on to something that millions of people deal with, migraines. It turns out some studies suggest Q10 might offer a bit of relief here too.
Okay, now the details here are absolutely key. A big review of multiple studies found something really specific. CoQ10 didn't seem to make the migraine pain itself any less severe, but it appeared to help in 2 other ways. People got headaches less often, and when one did hit, it didn't stick around for as long. For anyone who suffers from migraines, you know that's a huge distinction.
Next up is fibromyalgia. This is a really tough, complex condition known for causing widespread pain and fatigue. So could CoQ10 have a role to play here?
Check out this number. One study looking at fibromyalgia patients found that CoQ10 could improve pain-related outcomes by as much as 37%. I mean, for anyone living with chronic pain, a reduction like that could be an absolute game changer for their daily life.
All right, our 4th area is a bit more specific. We're looking at some research into CoQ10's potential to help with erectile dysfunction.
Now, the context for this study is everything. Researchers were looking at men who also had high blood pressure. And for the guys with mild ED, about 1 in 5, 20%, actually reported no more symptoms after taking Q10. But, and this is a big but, for men with moderate to severe ED, the supplement really didn't seem to move the needle.
And for our 5th and final potential benefit, we're looking at diabetes management, specifically how CoQ10 might help with blood sugar and insulin.
And get this, we're not just talking about one study here. This is from a review of 40 different studies, and the combined results suggest that CoQ10 can help lower some really key numbers for managing diabetes, like your fasting blood sugar, your fasting insulin, and even your HbA1c, which is that all-important snapshot of your average blood sugar over the last few months. Okay, so we've seen some of the potential upsides, but that of course brings up the next question. How would you even go about taking it? So this next part is all about the practical side of things. The very first thing you need to get is that there's no magic number, no one-size-fits-all dose. And this slide really shows you why. In studies on heart health, you might see doses around 100 to 400 milligrams a day. But then you look at studies for neurodegenerative conditions, and they've used doses as high as 3,000 milligrams. That enormous range is exactly why you can't just guess. You need professional guidance. So if CoQ10 is something you're even thinking about, here are 3 steps that are absolutely non-negotiable. 1, and this is the most important, talk to your doctor or another healthcare provider. They'll help you figure out if it's even a good idea for you and what dose makes sense. And 2, when you're actually looking at supplements, look for a seal from a third-party tester like NSF or a US Pharmacopeia. That's your best bet to make sure what's on the label is actually what's in the bottle. All right, before we get to the finish line, we have to talk about safety. Because just because something is natural or sold over the counter doesn't automatically mean it's risk-free. This is probably the most important thing to understand about any supplement in the US. It's a direct quote from our source material. The FDA does not vet supplements for safety or effectiveness before they go on sale.
That is a world of difference from prescription drugs. The burden of making a safe, informed choice really falls on you and your doctor.
And this is a huge one. CoQ10 can actually interact with some very common medications, sometimes making them less effective. We're talking about things like the blood thinner warfarin, insulin, and even certain cancer drugs. This is yet another massive reason why you absolutely have to have that conversation with your doctor before you even think about starting it.
Now, on the flip side, the good news is that CoQ10 is generally considered pretty safe. No serious side effects have really been reported in the research. When people do have issues, they're usually mild things like a little trouble sleeping, especially at higher doses, or maybe an upset stomach. It's good to be aware of them, but they aren't typically a major concern.
Whew, we have covered a lot of ground here, right? From what happens inside your cells, all the way to clinical trials and safety warnings. So, what's the bottom line here? What's the one thing you should really walk away with?
Here it is, plain and simple. The research we've looked at shows that CoQ10 has real promise in a few key areas, but it is so important to see it as a potential tool in your health toolkit, not a magic bullet. It's meant to supplement a healthy lifestyle and proper medical care, never to replace them.
And really, that leads us right to the end. With all this information, the smartest next step isn't to rush out and buy a bottle, it's to have an informed conversation. So the real question is it time to ask your doctor if CoQ10 might be right for you? Thanks for tuning in.